We're constantly having to adjust things based on budget cuts, specifically since COVID happened.
Your workload is increased and you're spread thin, that you have a tendency to miss something.
One of the fears that as a nurse, and I'm sure many nurses that think, did they forget something? And I know I've talked to many nurses, they're like, if I had more time, I would have done this differently. Or I think I forgot to mention it to the doctor.
We don't have break nurses, for example, so we have to cover each other for breaks, and sometimes that's just really unsafe. So we just don't take breaks, because otherwise I'd have to watch 4 ICU patients for over an hour at a time, which is just very unsafe.
We are down about over 400 nurses in our hospital currently. We're being covered by travelers who are making more than me, and my pay is high, but when nurses who are travelers make, like I've said, 2 to 5 times more money than I do hourly, that's insane, and that's to me is disrespectful.
On any given shift, about 30% of the nurses I work with are travelers. There's a lot of teaching that we're doing all the time in terms of our hospital policies, just the standards of how we do things they're not familiar with, so we constantly are having to educate on those. And it's a little demoralizing just because they're only there sometimes for a few months, and then we get a whole new group of travelers, and we're just kind of starting over every time.
It's interesting, especially if we get a group of travelers that come on at the same time, because for the most part, they'll probably be leaving at the same time. So then it's a matter of training people up real quick. Here's where this is, here's this important thing. Okay, get going.